Thank you. Thank you very much. Thank you for this exciting invitation to speak today, and thank you everybody for joining. Just hopefully share my slides. Here we go. The slides are displaying okay.
Perfect.
Brilliant. Thank you. So yes, hopefully today I'm going to walk you through how you can go about integrating the findings of a qualitative evidence synthesis, so QES, with the findings of a systematic review of effectiveness. If you have questions following the question time at the end of this, my details are there on the slide, so you're always welcome with people to get in touch. So just a quick overview of what I'll be discussing today. So just to ensure that we're kind of all on the same page, I'm sure many are familiar with this concept of mixed method systematic reviews, and then a very brief consideration of why we might integrate diverse evidence types in a mixed method systematic review. But the majority of what I'll talk about today is this sort of deep dive into how we can go this process of integrating these diverse types of evidence. And I'll take you through three broad approaches: assimilation, comparison, and connection. And then I'll finish up with some kind of reflections on how you decide which of the possible approaches that you might want to use in which circumstances. And I'd like to kind of acknowledge lots and lots of people who've kind of informed my understanding of how we go about this, but in particular to say that what I'm discussing today is work that I've been doing, particularly with Angela Harden and Jane Noyes, as part of writing for the new Cochrane-Campbell Handbook for Qualitative Evidence Synthesis. And so they've supported this thinking and work. So what do we mean by mixed method systematic reviews? So back in 2017, Quan-Na Hong and others described this as reviews which combine qualitative and quantitative evidence. A bit more recently, Quan-Na was over and based at the Epicenter for a little while, and she did a case study of the Epicenter reviews, determining which ones were mixed methods and what the mixed methods was. It's like, and it was a kind of quite eclectic group of research and approaches within that, which kind of encouraged her to perhaps broaden the conceptualization of mixed method reviews to take account of a variety of sources and types of evidence, such that the definition evolved to becoming reviews should be considered mixed when they include more than one kind of research question. So, for example, a question about intervention effectiveness and a question about views or experiences or implementation, or where they include more than one type of evidence. And that might be including in-depth interview studies, as well as fixed response survey data, so qualitative and quantitative, but perhaps again getting at views and experiences. So it's one question, but two types of evidence. But I think where I come from is that regardless of whether you're looking at a single question with diverse evidence or multiple questions, the key goal of a mixed method of systematic review is to look at a single issue from different angles. So I use this image of an iceberg to illustrate that, is that you, from looking at an iceberg from above the water, you'd have no conception of its size, shape and form. You need to look both above and below the surface of the water to really get a handle on what that iceberg looks like. And that's, I think, where mixed method systematic reviews really bring value. And so what do we mean by, we're focusing on the integration of diverse types of evidence here, and what do we mean by these diverse types of evidence? And again, I'm sure that, you know, this is not new to you, but really just to be really clear that we're not talking about just words versus numbers. We're thinking about bringing together evidence that's gathered using very different research traditions and has very different purposes, where qualitative research aims to generate theory or theoretical concepts. Quantitative research is focused on either testing or measuring those concepts. And those research traditions themselves are underpinned by very different philosophies. So where the quantitative research is aligned with a realist approach in the sense that there's this underpinning idea that entities exist independently of being perceived, whereas qualitative research takes this more idealist or interpretivist approach that the empirical necessarily exists always in the form of human pictures and conceptions of it, so that the perception of reality is what they're interested in there. And so this idea of looking at something from different angles, when we consider those very different research traditions and philosophies, it's very clear that what we're doing is looking at the same issue, but from very different angles. So given that's what we're doing, we're integrating diverse types of evidence in a mixed method systematic review. Why might we do that? And there's a huge range of reasons why we may do that. And I've just given a couple of examples here. So for example, if we wanted to understand which outcomes are important to patients, so a perception, and whether those are measured in our trials. Or, and this is kind of more what I'll focus on today, if our goal is to better understand interventions characterized by complexity. I think there are a few interventions that are not characterized by some measure of complexity, but interventions that are social in nature or delivered by people are inherently quite complex things going on. So what we're integrating is these two syntheses. The quantitative synthesis provide us with some evidence on the magnitude of the effects of the interventions under study, and the qualitative evidence synthesis will deliver us, help us to generate theories and explanations for why and how interventions might work or not work. And the integration allows us to explore, for example, then, where we have variation in the outcomes of interventions, we may be able to explore why some are more effective than others. And that's the kind of knowledge that mixed method reviews deliver. That's kind of, it enables implementation. If we understand, if we've learned that an intervention is broadly effective, but we also understand how and why it works, or the context in which it might not work, then we can apply that knowledge in practice. So, as I said in the introduction slide, I'm going to walk you through three broad approaches to integration, reflecting those identified or highlighted in the Quan Na Hong 2020 paper. So the first broad approach is assimilation, and I've illustrated that with the mixology here, because the idea in assimilation is that you mix the different types of evidence together, give them a stir, and they're all lumped in together or merged, and so that you wouldn't notice the constituent parts once they've been mixed or merged together. They're all in the same synthesis in the same way. The second broad approach is comparison, and often that involves some kind of juxtaposition. So as in illustrated here in the image, these two building fronts, what are the points of similarity and what are the points of differences here? By aligning them or juxtaposing them, you're able to see and identify patterns of difference and similarity. And the third is this idea of connection of phases, illustrated here. The point being that the person on the left here has done the thinking or the first synthesis and got this knowledge of the findings of that review, and that's communicated and then informs the second synthesis, which is kind of being in process in the image of the person on the right there. So the first synthesis is instrumental in how the second synthesis is conducted. So let's take a look at assimilation first. And I'm not going to cover assimilation in great depth, but it is an important approach to know about. And generally the purpose of an assimilation approach is where the goal is to increase the pool of available evidence. And the key feature of an assimilation approach is that they're typically designed to answer a single question. What do we know about this? Or what have we learned about this particular issue? And because all of the evidence is marshaled in the same way, mixed together to answer this single question, it's clear that the assumption here is that the quantitative and the qualitative evidence on this similar topic can address that same research question, so they can be synthesized together in the same way. And typically that means that we'll need to transform one type of evidence, either the qualitative or quantitative, into the other type, so that both sets can then be merged together in some ways. And most typically, the focus has been on transforming quantitative evidence, so numbers or counts, into qualitative evidence, so words or themes, in order to allow it to be merged. There is also a small body of work on quantifying qualitative research evidence, so calculating qualitative effect sizes to quantify the strength of relationships found within qualitative research. So if you're interested, have a look at the work of Leonie van Grootel and others. But this kind of approach is relatively controversial and contested, and as I said, not widely used, but if you're interested. So here's just an example of a systematic review in which this qualitizing approach is described, and there's not much here. So this is a review on barriers to cervical cancer screening among women living with HIV in low and middle income countries. And the abstract is there, and you can go and see more if you'd like to have a look at this review. But what I've indicated on this little snippet on the right, where they're describing the analysis of studies, you can see that a consensus is that quantitative data from surveys and questionnaires were qualitized and coded. And then, so they qualitized the quantitative data. They then go on to say that data from the qualitative studies were coded line by line, and then all of that data, they were looking for patterns for search for amongst all of the code data. So once the quantitative data being qualitized, they were looking at all the evidence in the same way. So I'm going to not go any further with thinking about this approach of assimilation, but they've got the approaches of comparison and connection that I'll take you through in subsequent slides. We've got key examples, worked examples to walk you through. So let's take comparison first. So here, where the goal of that assimilation approach was just kind of increase the pool of evidence and synthesize it all in the same way. What distinguishes comparison from that is we're looking at varied facets of the same complex phenomenon. So we're not pooling it or merging it all together. We're building on the fact that we've got different types or diverse types of evidence, which leads us to have separate questions. We have a question for the qualitative evidence for the QES, a question for the quantitative synthesis, separate questions, and then maybe even a third question, which is about the integration or the mixed method synthesis. And so the assumptions here are that because of the distinct methods and worldviews that underpin those different types of evidence, they're going to need to be synthesized separately, but that the findings of one type can help to inform or explain the findings of the other. And the strategy here when we're doing comparison is this juxtaposition to offer insight into how the different types of findings can be interpreted. So within comparison, when we're looking at the literature, we identified four sort of general comparative approaches, or four distinct comparative approaches. And there may well be more, but I think these are a really nice illustrating of how this broad approach can differ. And they differed, I suppose, in terms of their aims and what they compared and how they compared it. So I'll take you through four examples. The first, where the aim was to illustrate the weight of evidence supporting some QES-derived themes and any gaps in the evidence, so that what was compared here was the themes derived from the QES with the synthesized findings from the effectiveness synthesis, and a matrix was used to do that. Then in an example 2, it's similar but slightly different. So the focus was not on the synthesized effectiveness findings, but the individual interventions included in the effectiveness synthesis. And they were compared to the themes in terms of needs and preferences that emerged from the qualitative evidence synthesis. So again, a matrix was used, but the QES themes were not compared with the synthesized one, they were compared with individual interventions. And I'm going to illustrate these, but I'm just kind of, this is an overview. The third approach is to illustrate a kind of a more holistic theoretical output from a qualitative evidence synthesis, and then juxtapose that against the effectiveness findings. So the QES theory in this third example, in the form of a logic model derived from the QES, is compared with the effectiveness findings in what we've described here as an annotated logic model. And then the fourth example is a mixed method review in which the findings of the QES and the effectiveness synthesis were so discordant that this kind of trying to bring them together in some kind of visual was really challenging. And so the QES themes are compared with the quant findings, but not using any of these devices for comparison, but by using a line of argument to illustrate the areas of discord. So let's take the first example. Many of you will probably know Catherine Horton and her colleagues and this excellent work I was fortunate to be involved in on the factors that impact on recruitment to randomized trials in healthcare. So the work that Catherine and colleagues was doing was a qualitative evidence synthesis aiming to explore potential trial participants' views and experiences of the recruitment process for participation. And then they looked at what extent those barriers and facilitators that were identified are actually addressed by interventions to improve recruitment evaluated in previous effectiveness reviews. So the integration involved combining or juxtaposing the QES findings against the findings of 2 previous intervention effects reviews in a matrix. And the value of this particular approach was that the QES enabled the development of key questions that trialists could ask when developing recruitment strategies, and were able to then map those out and see whether there was any evidence that those strategies would work in actuality. So here's a portion, it's not the entire thing, but a portion of that matrix, which is reported in the review. You can go to the review and see the whole thing. But I'll just walk you through what we're seeing here. So here in the left-hand column are the key findings from the QES. So finding 1 here is that trial information delivered verbally during face-to-face contact can be less confusing than written trial information. Then we have finding 2 and finding 3, and it goes on. There are many, many findings from the QES. So these are derived from the qualitative evidence. Here are the kind of those questions that were developed from those QES findings. So in this, in relation to finding 1, will trial information be delivered verbally with face-to-face contact? And then the final columns, and there are 2 columns here because there were 2 effectiveness reviews. So there's the Truiq review and then the Gardner review. I've mapped on where there's evidence from those reviews in support of that theme or finding, or that in response to that question. So here, in relation to finding 1, the Truiq review found that the researcher reading out the consent details was an effective approach, but you can see here that it's been graded for the strength of that evidence, and the assessment was that it was a very low confidence in that finding. We can also see that there's a gap here. So under the Gardner review, there's no evidence from that review about this particular theme or finding. So here you can see that juxtaposition of the qualitative findings against where do we have evidence that this is important from the effectiveness reviews, and where are there gaps in that knowledge. So that's approach 1. this second approach is that more detailed focus on individual intervention. So it's a review by Meganborough and colleagues on the perceptions and experiences of labour companionship. Again, this is a team that are doing the qualitative evidence synthesis after some effectiveness reviews had been done. And the objective was to explore the perceptions of a whole range of people, including women, healthcare providers, etc., on labour companionship, and to explore how the findings of this review can enhance understanding of the related Cochrane systematic review of interventions. And the integration approach again used a matrix, but what's being juxtaposed in the matrix is the QES findings against the content of individual interventions. And the value of this, it provided this really nice summary of how the QES findings are reflected or not in the content of interventions, ultimately addressing, so, you know, are the interventions that we have in this review actually addressing the identified needs? So I'll walk you through. Here's the matrix from that review. What we have here is the list of interventions included in that review. So you can see there are a number of them. Again, I haven't managed to fit the whole matrix on screen, but you know, it's a long list of interventions in this table. Here on at the right hand side of the screen, we can see the findings from the QES in broad terms. So these were the kind of issues that were raised as being important. So were providers trained on the benefits of labour companionship is number one. Number two, were women educated about the benefits of labour companionship? Number three, was the labour ward structured or restructured in a way to ensure privacy? So we can see that there are 7 factors identified from the QES, and they are then illustrated in the columns. So the corresponding number is each column there. And then, so what we can see here is this first study evaluated an intervention where in relation to factors 1 through 5, it was uncertain. So that's signified by the question mark. Factor 6 has not applicable, because factor 6 is about specifically about trials with lay companions, and this was not a trial about lay companions. And then factor 7, we can see that the feature wasn't present, and number 7, as we can see in the left on the right hand side, was whether or not the woman was able to choose her own companion. So in this intervention, we don't really know about many of the features, but we do know that in this intervention the woman wasn't able to choose her own companion, which emerged as an important factor. By contrast, this review by Hands 2013, we can see that lots of the factors were addressed. They're highlighted in green. There's got to be the intervention was designed to address those issues, including that the woman in factor 7 was able to choose her own companion. So we get a sense of each individual intervention, and we get a sense of the interventions overall. We can see overall that in very few interventions, the women involved in that intervention, receiving that intervention, were not able to choose their own companion. Only a handful of studies allowed for that. So it's quite a nice summary of what we're seeing in individual interventions. It's less related to whether or not those interventions are effective or not. But we can see the nature of interventions, and we do so by using our knowledge from the QES. But the main takeaway from that integration was that most interventions in the effectiveness synthesis did not include the key features of labour companionship that were identified in the QES. Okay, so example 3 now is where the QES was used to produce a logic model. So the team are really interested in the mechanisms of how their intervention worked. And the intervention in question is care farms, so essentially therapeutic use of agricultural and farming practices. And the reviewers were interested in how care farms impacted on quality of life, depression and anxiety among different population groups. And the objective this review. So the reviewers on this review did all of the research. They weren't relying on pre-existing effectiveness reviews. They reviewed the available evidence of the effects of care farms, and they also did the qualitative evidence synthesis to understand the mechanisms of change. And so when they came to integrate the findings of those two parts of work, they used the qualitative evidence synthesis to produce these logic models which depicted care farm components, mechanisms, and outcomes, or sort of proximal outcomes, what would be expected in terms of kind of nearer outcomes rather than eventual health outcomes. And then the effectiveness evidence was mapped on to those logic models to identify whether that theory, that mechanism that's been theorized using the qualitative evidence was borne out with the evidence that it actually resulted in health benefits. And the nice thing about this approach is it communicates the complexity of the intervention theory against the nature, extent, and direction of the effectiveness evidence. So here's one of the logic models from that review. There are several, and there's a lot in there. So you may want to go to the review itself and have a look at some of these in more detail. But what you can see on this side is here we've got the intervention components. So we've got the setting, the farm itself, the physical space, and the kind of the theorized mechanisms of being alone, offering a quieter, less fussy environment, escape from negative environments, other kind of related intervention components of being able to work in a group as a colleague alongside others. The farmer is one of the intervention components, offering choice in work tasks, the work itself, being able to be involved in practical, useful work, and being the final component being the animals, and being sort of able to be involved with and learn to care for animals. And we can see then how the QES identified mechanisms that arose from those intervention components. So these sort of more issues around mental well-being, personal growth, being socially connected, and these ideas of physical well-being. And then over here on the very right-hand side, these symbols indicate the effectiveness evidence. And so where each row indicates a single outcome evaluation, where there are two symbols, that's because the study measured outcomes at 2 time points. Where the symbol is a dash, that indicates that the intervention didn't show positive effects. Where there's a plus, that's an indication of positive effects. And you can see them aligned against these different expected outcomes, so reductions in depression, improved quality of life, and reduction in anxiety. And essentially what you can see here, there's a few trials in relation to each, and there's showing a pretty mixed picture of the evidence. But what's nice about this is you can see kind of the whole theoretical framework of how care farms are expected to work, and you can see these proximal or process outcomes in terms of leading to increased confidence and self-efficacy. And we actually had some, or there were some trials which showed the outcomes for these sort of more proximal or process outcomes, as well as the ultimate outcomes of depression, quality of life, and anxiety. So you can kind of see the whole thing at a glance. So it's a nice approach showing the intervention mechanisms. So the final example of comparison is where this is a review I was involved with colleagues at the Epicentre. It was led by my colleague Sarah Lester, and it was a review on adverse childhood experiences. And we, as a whole team, did both the effectiveness and the qualitative syntheses. And the approach that we took for comparing the evidence ended up being a line of argument approach. And I have to say, we did this work before I'd even, before I'd done this work for the book. We kind of responded to what we had, and this is what we ended up with. And so the review was tasked with trying to understand what helps to mitigate the harmful impact of adverse childhood experiences, of abuse, or having a parent with mental health problems. There's a whole range of things that are under this umbrella of adverse childhood experiences. And there were 3 parts to the review. So we did a review of reviews, or umbrella review overview, on the effectiveness of interventions, qualitative evidence synthesis on experiences and service needs. And then we also did some stakeholder consultations with young people. And the integration that we ended up using, the approach we ended up using, was this line of argument to illustrate key areas of discord between the types of interventions examined in the systematic reviews and the findings of the QES and the stakeholder consultation. And the reason we used this line of argument approach, I think, with hindsight, is because the work exposes really fundamental disconnections between the types of interventions that have been examined in systematic reviews and people's needs as revealed in the QES. And I'll show you what that looked like. So we identified 3 key areas of discordance. One of the key themes that came out from the QES was the importance of having this day-to-day support in terms of both practical support and emotional support, and that was underpinned by having these trusting relationships with other adults, or maybe mentors or peers. And it was a really consistent finding of the QES. But by contrast, when we looked at the systematic reviews, they were largely focused on psychological crisis point type interventions, so CBT type kind of approaches. So in the short term, these psychological interventions could improve people's mental health, but they're really failing, or they're not designed to address these multifaceted and ongoing everyday needs of young people. A second thing that the QES highlighted was that young people really valued consistency and stability in their relationships, and that many of the interventions evaluated in the systematic reviews are very much short-term in nature. So they weren't able to build those trusting relationships because the interventions were so short. The third thing that the QES revealed was that children and young people felt that having supportive adults with particular attributes of things like empathy and trustworthiness, dependability, authenticity, were more important for providing effective support than their professional role. And the interventions evaluated in the reviews tended to be delivered by staff that were otherwise unknown to the young person, either in community or clinical settings, so that those attributes wouldn't have been known to the young people. So we can see here that it was almost impossible to do. I mean, I'm sure somebody creative, if we, or even ourselves, if we thought about it now, trying to create a visual that juxtaposed these, but because they were so fundamentally disconnected, this kind of line of argument approach seemed appropriate. So that's comparison. Just to recap, the approach looks at various facets of the same phenomenon using separate questions, and the strategies use these different tools or devices to juxtapose the findings to offer insight about how the different sets of evidence can be interpreted. And there are these 4 approaches that we've identified in the literature. So moving on to connection. The purpose of this approach differs from the comparative approach in the sense that we're looking at very facets of the same phenomenon in very separate syntheses, but we use the findings of one synthesis to inform the conduct of the other. So the second synthesis wouldn't happen in the way that it did without the conduct of the first one. So much like the comparison approach, there are separate questions for each element of the review, and the assumptions are still that the distinct methods and worldviews underpinning qualitative and quantitative research mean that they ideally synthesize separately But here, the assumption is that the synthesis of one type of evidence can inform the synthesis and conduct of another. So the strategy here is to connect the two in some way. For example, to test qualitative evidence synthesis derived theories using our effectiveness evidence. So 3 key strategies here. Using, as I've just described, hypotheses derived from the QES to drive, for example, subgroup analyses in a meta-analysis. The second, using an approach that I've been working with quite a bit lately, qualitative comparative analysis, which is really an approach designed to look at intervention complexity. So looking at combinations of intervention, contextual and implementation factors. And so there, the QES drives how you do the qualitative comparative analysis. And the final example here was the one example of connection that we identified in the literature, where the first synthesis was the effectiveness synthesis, and the existing effectiveness syntheses, and in this case a guideline, what drove the structure and extraction of qualitative data for QES. So it's kind of the one example that's flipped. The first 2 use the QES findings to drive the synthesis of effectiveness evidence. And just more generally speaking, these connection approaches, they often involve some level of comparison as a kind of a first step, and B, they are much rarer in the literature. We're seeing fewer of them, and I think it's because it's sort of a natural progression from comparison and requires the right kind of evidence and enough evidence to be able to do this kind of work. So we're seeing fewer of them, but it'd be great to see more of them. So the first example here, where the QES informs some subgroup analyses in a meta-analysis. And I'm sure you're all familiar with this example, Children and Healthy Eating review that was conducted way back in the early 2000s. And it was kind of some formative in my career, an opportunity to be involved in this exciting work. The review objectives were to understand what is known about the barriers to and facilitators of healthy eating amongst children aged 4 to 10 years old. It was sort of in the context where governments were looking at introducing this recommendation to eat five a day fruit and veg. And the integration objective here, which emerged, it wasn't kind of necessarily planned from the outset, but we were able to derive hypotheses from the QES that could then be tested using the effectiveness or the quantitative data. So the QES provided these analytic themes about important intervention features, and then we could do subgroup analyses comparing those interventions which address that feature against those which did not. So if you think back to the Labour Companions review, some of those interventions addressed particular features and some didn't, and you could compare the effect sizes for those interventions which did and which did not, and that's effectively what we were doing here. So the QES suggested a couple of things that we wouldn't have thought of in advance were important. One, that interventions should treat fruit and vegetables in different ways. Kids tended to like the sweet fruits and they had different views about vegetables. And another key thing that we wouldn't have thought of with our sort of public health promotion hats on, that we shouldn't be emphasizing health messages or health warnings or be focused on your future risk of cancer with these 4 to 10-year-olds. But that's what emerged. They're not interested in those kinds of things. So then we did some subgroup analyses to see whether the intervention effects seem to be aligned with that. So this bar chart illustrates the findings of individual interventions illustrated in each bar in relation to, and the colours indicate whether or not those interventions emphasised a focus on the health benefits of fruit and veg. So the red ones are the ones that de-emphasise or don't emphasise the health benefits, and those that in the blue or purple are the ones that do. And what you can see is that those red bars, so those two on the very first two, Wardle and the Curie, are the ones that did not focus on the health benefits, and they were the largest effect sizes. So it's you know, we perhaps don't want to extrapolate too far from that, but it's clear from this evidence alone that reducing an emphasis on health messages, so in line with what children were saying, isn't harming the outcomes of those interventions. So the next example is the one of exploring intervention complexity using qualitative comparative analysis. So some work that I did with many colleagues, including fabulous GJ Melendez-Torres, around identifying the critical features of successful weight management programs for adults. And so we were looking at intervention, contextual and implementation factors that might influence intervention outcomes. And we derived our understanding of what features were key from the QES. And then we used those QES findings to examine combinations of interrelated factors. So the QES essentially provided our working theory to structure our qualitative comparative analysis. And it was really valuable in helping to sharpen our focus on the most salient features to be examined, as well as supporting our interpretation of the QCA findings and ensuring that we avoided data dredging. So there are so many possible features of and contextual features and implementation features of interventions that we couldn't have examined. I mean, hundreds. The value of QCA is that you can examine multiple features, but it's a handful. So the QES helped us to determine what we should really be focusing down on. And this is a summary of the findings of that review. So if we take this table, the first row is around our review finding that a critical feature of effective weight management programs is a focus on having a good relationship with the program provider and the participants. And the second column, you can see some example text from one of the included studies where you've got that good relationship, you feel that somebody is batting for you. And that seems to be important to participants in these programs. And so what we did is we had an existing effectiveness census. We had about 40 trials in, and we compared the 10 most effective ones to the 10 least ones, and to see whether they were aligned with that kind of intervention approach or not, and found that all of the most 10 effective interventions were aligned with that. The intervention emphasized developing that positive relationship with the provider, as well as having another feature which seemed to be aligned with this, which is around fostering self-regulation, whereas the least effective interventions, all 10, either had no emphasis on fostering that relationship, or they did have a focus on that, but they didn't foster self-regulation characteristics. So there was a really distinct difference between the nature of the most effective and least effective interventions, and that was aligned with what we were finding from the qualitative evidence synthesis. So the final example by Kate Fleming is the one where the existing effectiveness research is used to structure the qualitative evidence synthesis. And this was examining morphine to treat cancer-related pain, and there was an existing effectiveness review and a guideline, and the findings from those were used to produce this matrix into which the qualitative evidence was then slotted. So just a very brief look at that matrix. So again, we're coming back to a matrix, but it's kind of a flipped approach here. So what we can see in this top row are the key guideline recommendations or implications from the effectiveness review. So for example, to use opioids as the first choice, to use morphine, as the first choice of opioids. And then each row here is an individual qualitative study and their findings. So we can see in relation to this idea of morphine as the first choice of opioids, Coyle 2004 had this finding that morphine was viewed as positive to relieve pain, and that good analgesia leads to a sense of control. So we had some evidence in support of the guideline. So just to recap on the connection approaches, use the findings of one synthesis to inform the conduct of another, connecting the findings from the QES and the quantitative or the effectiveness synthesis, for example, to test the QES derived theories. And as I said before, the connection syntheses often involve the use of comparison as a first step in the analysis, and we might see connection as kind of, if we can do it, achieving one step beyond a comparison. And there are various ways in which this has been done. So this is a very busy table, and I think we're sort of, close to wanting to move on to questions. But essentially, it's kind of my assessment, and you may have your own views on this, of when individual approaches are useful. So assimilation, I think, is useful when we've got a limited overall pool of evidence, and it makes good use of that scant evidence, but its limitation that it doesn't harness the diverse types of evidence. And there are various situations in which different comparison strategies and connect strategies may be useful, and they have their own inherent strengths, but they also have limitations. And some of that is because they depend on having the right kind of data, the right kind of evidence in order to be able to enact them. So these are some of the considerations when you're thinking about, so which approach should I be using? The selection of your approach needs to balance, yes, your review, aims and purpose, but also which approach is most suited to the evidence you have available to you, as well as the resources, time and skills you have available to you. Because of this need to tailor the approach to the evidence at hand, be mindful of the fact that it's not always possible or even preferable to specify in advance what approach you're taking. So you might identify, if possible, I would like to do this, or we would take this approach, you know, if the data lends itself to that, but you won't know until you get the actual evidence whether you could actually enact that approach. A third or key thing is that this is kind of my interpretation of what we're seeing in the literature so far, but mixed method systematic reviews and mixed method more generally, and inherently creative approaches. So what else might be possible? And at the base of all that, in terms of thinking about what might be possible, is how can we harness this value of having these very diverse sets of evidence that allow us to see more holistically what's going on in our world. So I will stop talking now. If you're interested in more, I'm coming with colleagues James Thomas, Angela Harden, to run a 2-day workshop on mixed method systematic reviews in September in Galway, and I believe there are still spaces for that workshop, but there's also the link to the Cochrane Handbook chapter that this presentation is based on.